I'm Kendall.
And I'm Hannah.
And for our topic, we chose contemporary trends and issues in nursing. So, our first question that we have are what are contemporary trends and issues?
Contemporary trends are current developments that are changing healthcare delivery and nursing practice.
And contemporary issues are challenges that affect patient care, healthcare organizations, and the nursing profession as a whole.
So, some examples of contemporary trends and issues include telehealth expansion, nursing workforce shortages, antibiotic resistance, evidence based practice, healthcare technology and informatics, patient safety and quality improvement, as well as healthcare cost.
To talk about telehealth since it is becoming way more popular. Telehealth is the use of digital technology such as phones, video calls, computers, and mobile apps to provide healthcare services remotely. According to the CDC, telehealth uses electronic information and telecommunication technology to support long distance clinical care, patient education, health professional education, public health services, and even health administration. Telehealth has become increasingly important because it allows patients to connect with healthcare providers without needing to travel to a healthcare facility to see them. So, in this slide, we talk about some of the benefits that we see with telehealth, and there are several of them. One major advantage is that it increases access to healthcare for medically underserved populations, especially those who live far out in rural or remote areas. Telehealth can also reduce healthcare costs by decreasing travel expenses and improving efficiency. Many healthcare professionals believe telehealth can improve overall health outcomes by making care more accessible and convenient for everyone. Additionally, it helps address provider shortages by allowing patients in areas with limited healthcare resources to receive needed services. On the flip side, there are some complications that we see. Although telehealth offers many advantages, there are some challenges that we are trying to overcome. One concern is information security, since patient data is transmitted electronically and must be protected from all cyber threats, which is also a growing issue. Patient privacy is another important issue as healthcare providers must ensure that confidential information remains secure. Licensing requirements can also be complicated because providers may need authorization to practice across state lines. Insurance reimbursement policies may vary, which can affect payment for telehealth services. Finally, the last complication that we may see is that liability concerns exist because healthcare providers must maintain the same standard of care during virtual visits as they would during in-person important appointments.
The next topic is nursing shortages. The nursing profession continues to face shortages due to a lack of potential educators, high turnover, and the inequitable workforce distribution. The causes of the nursing shortage are numerous and of concern. So, not only does the nursing workforce shortages have an impact on nursing, but they also do on patients. So, the impact on nursing includes increased patient loads, higher stress and burnout, more overtime, and staffing gaps. And then the impact on patients are longer wait times, increased risk of errors, and reduced quality of care in some settings. And then nurse burnout. This quote says, some nurses graduate and begin working only to determine that the profession is not what they expected. Others may work for a while, experience burnout, and then leave the profession. Turnover in nursing seems to be leveling off, but only after years of steady climbing in rates. Currently, the national average turnover rate ranges from 8.8% to 37%, depending on the geographic location and the nursing specialty. And then I included this chart, and this explains some nursing burnout statistics to know. It says 60% of acute care nurses report feeling burned out, and 75% report feeling stressed, frustrated, and exhausted. It also explains that the nursing provider shortage won't hit all states equally. It says 100,000 nurses left the workforce from 2020 to 2021. This was the largest drop in about 4 decades. It also explains that 1 in 4 nurses intend to leave the profession. This is almost 30% of nurses considered leaving in 2021 versus 10% in 2020. Some causes of the nursing burnout include increased workload, poor staffing ratios, lack of organization, interpersonal conflict with colleagues, emotional distress, and long and demanding hours.
Trend affecting healthcare today is antibiotic resistance. We have learned a lot about this in class, and it is starting to become more of a problem. In simple terms, antibiotic resistance occurs when bacteria changes over time and antibiotics no longer work to kill them. This means that infections become harder to treat, patients may stay sick longer, and the risk of complications increases. One reason this happens is the overuse and the misuse of antibiotics. For example, some people taking their antibiotics once they start feeling better start to skip doses or take antibiotics when they aren't needed, such as for viral illnesses like the common cold, when, as we know, antibiotics only work for bacterial infections. The World Health Organization has warned that the antibiotics resistance is becoming a major global health concern because we are running out of effective antibiotics that help treat certain infections. As nurses, patient education is very important. We can teach patients to take antibiotics exactly as prescribed, complete the entire course of the treatment even if they start to feel better, never share their antibiotics with others, and avoid requesting antibiotics for viral infections. We can also encourage good hand hygiene and infection prevention practices to help reduce the spread of resistant bacteria. Another topic that might arguably be one of the most important ones is healthcare cost. Another major issue in healthcare today is the rising cost of the care that's being provided. Healthcare costs include expenses relating to doctor visits, hospital stays, medications, medical procedures, and long-term treatments. Healthcare costs have continued to increase over the years. Advances in medical technology and treatments have improved patient outcomes, but they have also made getting care way more expensive. In addition, more people are living with chronic conditions such as diabetes, heart disease, and hypertension, which often require ongoing treatment and monitoring. Insurance costs have also increased, with many people facing higher premiums, deductibles, and out-of-pocket expenses. Because of these financial challenges, some individuals delay seeking care, skip medications, or even avoid treatment altogether. This becomes a serious issue because when patients cannot afford health care, their conditions may worsen over time. Delayed treatment can lead to complications, hospitalization, and even higher healthcare costs in the future. As nurses, it is important for us to recognize these barriers that our patients are having and help connect them with available resources whenever possible.
When I saw the termination notice come in, it was kind of nerve-wracking.
James DeGilio is 62 years old. He couldn't pay for his health insurance after costs skyrocketed.
I was paying last year $57 a month premium, and then it jumped up this year to $16.90 a month. When I first saw it, I was surprised. I thought this was a mistake.
Millions of people, like James, saw their insurance premiums soar in January after the Senate deadlocked on competing proposals, leaving the expanded tax subsidies to expire. James relies on medication to manage his blood pressure, cholesterol, and diabetes. Since losing his insurance, he started rationing his medication.
I was concerned about the medications, not knowing how I was going to refill them. Because I figure if I could stretch it out and not take them for a week or so, then that's another week I could tack on that I could still stretch it out to.
James works at a pizza restaurant, making $14 an hour washing dishes and delivering food. That brings in, on average, $1,200 a month plus tips. He says that the $1,690 health insurance payment would eat up all the income from his job.
It would have been very hard to manage to paying that much premium for health insurance.
He takes care of his sister, who is currently unemployed. In January, to cover their expenses, James took out his Social Security retirement benefits early. If he had paid for his new health insurance premium, on top of his other expenses, that would have left him nearly $1,400 in debt at the end of each month. For years, Florida has been leading the nation in Affordable Care Act enrollment. 1 in 5 residents are enrolled in an ACA plan, compared to 1 in 15 nationwide. And 98% of Florida's enrollees relied on federal financial assistance to pay for a plan. Now, many are facing a future without health insurance. More than 1 million people nationwide have dropped their coverage since the ACA subsidies expired. Today, with only a week and a half of medication left, James is visiting a free clinic nearby to see if they have the medications he needs.
Okay, if you just take a seat and I'll tell the nurse you're here.
Jimmy's case is not unique. All of our new patients who had insurance and now do not have insurance have all seen tremendous increase in their monthly premiums to the point that they can't afford them any longer.
Terry Balletto runs this volunteer-based clinic in Bunnell, a city in Northeast Florida. It relies on private donations and grants for its funding. She says her clinic has seen a surge in patients over the past 3 months.
This is the largest increase in patients that we've seen in the 12 years that I've been here. If we're not in crisis mode in healthcare in the United States, we're almost there.
So was it 2 months from now, you said?
For James, a measure of relief. Today, the clinic refilled over a month of medication for free. The clinic may have met his immediate healthcare needs, but what worries James is where to go for anything more serious and how he'd pay for it.
If I had affordable health care, my life would be easier. It would be more relaxed. And I could, not have to be stressed about the insurance and hopefully also medications.
There is also trends and issues with patient safety and quality improvement. Some issues with patient safety include healthcare-associated infections. This can be ventilator-associated pneumonia, as well as catheter-associated infections. There's medication errors, as well as patient falls. Some quality improvement goals include improving patient satisfaction rates, reducing readmissions, and reducing healthcare cost. The Joint Commission has created 14 national performance goals to help hospitals improve safety, quality, and outcomes. These 14 goals include the right patient, right care, culture of safety, preventing workplace violence, emergency readiness, high quality, safe care for all, preventing and controlling infection, pain management, safe informed care, reducing the risk of suicide, tissue transplant safety, wave testing, creating a secure and safe physical environment, health professional resource management, protecting patients and providers in imaging, as well as effectively managing medications.
This topic I wanted to focus on, since we talk about it a lot in class, is evidence-based practice. Evidence-based practice, or EBP, is considered the gold standard for providing high-quality, safe, and cost-effective patient care. Evidence-based practice means that healthcare professionals make clinical decisions using the best available research evidence combined with their clinical expertise and the patient's preferences and values. There are many benefits to evidence-based practice. It helps decrease the risk of medical errors, improves patient safety, increases patient satisfaction, promotes quality improvement, and can even reduce healthcare costs by ensuring that patients receive the most effective treatments for their conditions. The process of evidence-based practice follows what are known as the 5 A's. First, you ask a clinical question. Second, you acquire the best available evidence. Third, appraise the evidence by evaluating its quality and reliability. Fourth, apply the evidence in clinical practice along with professional expertise. Finally, you assess the outcomes to determine whether the change improved patient care or not. Evidence-based practice is important because it supports many of the healthcare trends and issues we've discussed today, including patient safety, infection prevention, healthcare costs, and improving patient outcomes as a whole. Here is a list of all of the references that we used to create this PowerPoint. In conclusion, healthcare continues to face many challenges, including nursing shortages, nurse burnout, antibiotic resistance, rising healthcare costs, and the need to improve patient safety. These issues affect not only healthcare professionals, but also the quality of care that patients are receiving. By utilizing tools such as telehealth, following a national patient safety goals, guidelines, and implementing evidence-based practice, nurses can help address these challenges and improve patient outcomes. As future nurses, it is important for us to stay informed about all these trends and continue providing safe, high-quality, patient-centered care.
And that is what we have for contemporary trends and issues in nursing. Thanks for listening.